Okay, welcome everybody. Thank you very much for dialing into this first WebEx session. This is one of a series of WebExes that we're running under the banner of the Health CDC Benefits Specific Interest Group. Okay, so let's have a quick chat about what the heck are benefits and why should I care about them? Well, first of all, there are organisations such as the Public Accounts Committee, which the NHS is accountable to, and they've said in the past and on many occasions that implementation of IT has resulted in delay, confusion and inconvenience, but in particular it's been poor value for money for the taxpayer. We're all taxpayers as well as the users of the NHS, and it's our job to ensure that we are spending money that the NHS is giving us in a way that's going to have benefits for citizens and be cost effective for taxpayers. Now, there's also a positive side to this, rather than the stick, the carrot. Project Management Institute runs a Pulse of the Profession survey every year, and every year the answer to this question gets wider and wider. So organisations that report high benefits realisation maturity have significantly better project outcomes, and that gap has grown year on year. And in fact, I'd like to know, for the ones who don't have high maturity in benefits, how they actually know they succeeded in the first place. So their success is dependent on measuring it perhaps by time, cost and quality, as opposed to whether or not what they've done has actually had the desired outcome. So what is a benefit? Let's have a talk about that. Let's give the textbook definition first of all. So the textbook says it's a measurable improvement. So you've got to be able to measure it. And it's advantageous to a stakeholder. So somebody cares about this. If somebody doesn't care about it, why are we doing it? And thirdly, it says it contributes to an organisational objective. Now, organisations set objectives at different levels. Sometimes they might come from government, from the Department of Health, or it might be individual organisations have internal objectives. But those objectives are how they decide what to spend money on and what's their priority. So if something's not a priority for an organisation, why spend money getting it? That's a little on the dry side. So another way of looking at it is it's the value of the change for stakeholders, the what's in it for me. But my preferred definition is it answers why do I care. This is why I get up in the morning. Disbenefits are the opposite. So they're a measurable drawback, which is a problem for a stakeholder and which detracts from an organisational objective. And we don't track disbenefits, drawbacks, then we're not getting a full picture of what we're succeeding. And if we try to present a rosy picture to stakeholders, only showing them the benefits and not showing disbenefits, drawbacks, then at best we look naive and at worst we look manipulative. But either way, we're not going to engender trust. So one of the techniques that we use as benefits professionals is something called benefits mapping. It's another way of showing the program on a page. And I think it would be really good if we worked through one together so we can see how we build one. And I hope that as we build, you'll see elements from your perspective that are particularly useful. So we start benefit maps with the objectives. And we said, didn't we, that these are the organisation's priorities of what they've decided that they need to spend money on in order to get. That means that they need to be stated as visions of achievement as opposed to statements of process. So we don't want to be saying we're going to open a training academy. We want to say what the result of that will be. And the result of that might be that we will provide the best possible care for patients with dementia and their carers. And that's the kind of thing that you can get behind, that gives you a sense of purpose, and that your team can have that shared purpose together no matter what it is they're doing, they're contributing to that vision of what they want to achieve as a group. So rather than talking about how you're going to get there, you need to talk about what the world will be like when you have got there. Now that's the basis of portfolio management. Having priorities across your organisation. So your organisation might say that they've got 6 priorities this year. One might be around improving patient safety. One might be around improving access to health records and care records for citizens. And another one might be around improving things in a particular area. Now, the organisation needs to decide what resources to put against those. And if they haven't got a clear sense of what benefits a programme can contribute to that organisational priority, that objective, how do they know to put money against it? Additionally, portfolios are about management of risk. So if they have a particularly risky programme, but it's going to contribute to their most important objective, they may decide to put some money against that one and balance it maybe with a less risky programme in another area. So then the objectives become the reason why we're doing the programme. And that needs to be a vision that isn't just written in the business case and then filed in the filing cabinet, but held front and centre by the programme team, by developers, project managers, business analysts, stakeholder engagement managers. Everyone in the group needs to have that shared vision. And then you have a cohesive team who are all working towards a single goal. So creating a vision is very important, and a lot of business cases we see struggle with this and tend to talk, as I say, about process as opposed to framing something that you can get excited about, that talks about a new world and a new vision for what things are going to be like in the future. Now you'll notice at the top of my slides I've got some little symbols, and the symbol for an objective is a green octagon, and that's the symbol that we'll be using throughout when we start mapping. And in a few minutes you're going to get to see one. Okay, let's move on from objectives. Another thing that we need to know about is outcomes and capabilities. So we've said we've got an objective to improve dementia care. And we know that one of the benefits, one of the ways we'll know we've met that objective is if we reduce admissions into hospital so that people are cared for in their own home. That's a measurable improvement. The patient and their carer is going to care about that, and it contributes to our objective. So the question then comes, what has to change and what do we need in order to get that benefit? So outcomes are a change of state, and they are binary. They switch on and off, basically. We have 3 types. We're going to stop doing something, we're going to start doing something, or we're going to do it in a different way. So we might, for instance, stop sending faxes and start sending email. That's the kind of thing that you get in an outcome. Now, that is the result of making a change. That's the result of changing a working practice. Another type of outcome, which we call a capability, is when we have an enabler that we can exploit. So, for instance, I needed to be able to see somebody's status in order to know what care to provide to them. And if their paper record is locked away in the bottom of somebody's desk drawer and that person is in a crisis, then I can't provide them with the best care. Whereas if I've got access to an electronic record where I can see everything about that person, then I've got the capability now to make better decisions. So we need to combine both the enablers or the capabilities, the technological solutions, with change. Because if we just provide the IT system but don't actually change our way of working, we won't exploit that capability in the right way and the benefit won't come through. So just to summarise then, objectives are our intended goals. Outcomes are the results of the action that we take, whether that action is to change our working practices or to provide an enabler. And benefits are the value that the people who are interested get from that change by experiencing those outcomes. Now, of course, all of this means that there's work that needs to be done. And the symbol for work is the oblong. And that work is going to be both to take actions in business change, such as writing a new standard operating procedure or making sure that you're changing a culture. Those actions can be procedural, governance, or they could be about changing the way that people think. But also, we've got to produce those capabilities, those enablers, haven't we? So that could be projects or work packages, work streams. If you're in an agile program, it might be the epics. So these are chunks of work that we know we need to do. And at this level, we're not going to define them in great detail. We're just going to say that we need a system that provides us with the ability to do a certain thing. For instance, to be able to see somebody's notes on a screen rather than having to go and try and find somebody's key to unlock their desk drawer at 5 o'clock on a Friday night. So work is what we do in order to get outcomes or to produce a capability. The Virginia Mason Institute in the States is quite famous in business management and in benefits. And they have an entire methodology that they've developed. And they say that 20% of the work on a program in order to get benefits is actually the technology, but 80% is change management, changing the way that people work. It's all very well to provide that technological enabler, but if people don't actually use it differently, then you won't get benefits. So for those of you who, for instance, are project managers, the interesting part of this is what you're getting from the benefits work is a plan of action, which you could put into a project plan. And that's going to give you a list of all of those enablers that you're going to need to provide, and also an understanding of what effects they need to have so that you can more accurately define your requirements. And business analysts in particular, I've found, are interested in that, because rather than going to a technical team and saying, what could we do? They go to a technical team and say, this is our vision, how can you help us achieve it? And it ends up with much more effective products that the business change people can then work with in order for them to apply business change appropriately and maximize those benefits. So let's have a go at doing a benefits map. And I thought we'd start with going on a holiday. Anybody who wants to chip in, please do, either through the chat or unmute yourself and put in your suggestions. So first of all, I need to say, what's the area I'm focusing on? What's my objective? Well, my objective is I want to go on holiday, and that's going to make me happy. And I need to say, well, what's stopping me at the moment? What is it that means I can't go on holiday? That means I need to get benefits in order to meet this objective? And the answer is I'm skint. I've just bought a new car, I'm afraid, so unfortunately all my money's gone on that and I have no savings. So let's have a go at producing a map about going on holiday. Now this is a bit of software that we often use in benefits. There are various ones out there. This one happens to be Realizer. And here's my objective, my personal happiness. I want to go on holiday. So what could I do that would save me money so I can go on my holiday? Anyone got any suggestions?
Go shopping at Lidl.
Okay, great, thank you. Is that Richard? Yes.
It is.
So I'm going to reduce my food budget. That would be my benefit, I think. That's what I'm going to save. And in order to do that, I'm going to start shopping at Lidl. But that means that I'm going to stop shopping where I was before. So perhaps I used to shop at Marks and Spencer's. So remember I said that outcomes are a start doing or a stop doing or a do differently. So stop shopping at M&S. Okay, so hopefully that's going to save me some money. And they're going to contribute to me reducing my food budget, which is going to save me money. That means I can go on holiday. Now, bit of a silly example, but, you know, doing this means that I'm changing my standard operating procedure for food shopping, aren't I? I'm changing where I go and how I purchase stuff. So I'm going to have a changed standard operating, can't type and speak at the same time, for food shopping. There we go. And therefore, I'm going to have some work to do. And that work is going to be to write new food shopping SOP, okay, standard operating procedure. And once I've done that work, I can have that. Now, it's not just me, though, in my household that goes shopping. So I also need to ensure that my husband knows about this changed standard operating procedure. Otherwise, he'll carry on going to M&S, won't he? So I need to have my husband trained on new food SOP, which means I've got another piece of work to do. Training on food SOP. There we are. So it's only in combination of both having a standard operating procedure and training my husband in that new standard operating procedure that the two of us stop shopping at M&S and start shopping at Lidl. That's great. Thank you, Richard. Have we got any other examples? Oh, get a part-time job. Find a rich man. I like that one. Thank you, Amy. That's great. Let's go with Andrew's part-time job for extra funds. Okay, so my benefit's going to be increased income. And in order to increase my income, I need to start a new job. But in order to start a new job, I'm going to have to pass an interview, which means I'm going to have to have applied for that job. You see how I'm building up this chain? We call it a chain of causality. Doing one thing causes the next. So in order to pass my interview, I need to apply for a job. Now I'm going to need an enabler here. I'm going to need my CV. So we're going to have, let's join that up. There we go. So I'm going to have another outcome here of CV updated in order to be able to apply. So I'm going to have two pieces of work. First of all, I'm going to apply for jobs. And secondly, I am going to update my CV. Good, so let's join them all together. I've updated my CV, which allows me to apply for jobs, and I've been on the job sites and found a job to apply for, and there I've got increased income, which allows me to go on holiday. Now, Andrew made a very good point. I'm not going to have as much social time. I could describe that actually as a disbenefit. So I'm going to spend less time with people, which might mean that, let's say I lose friends. I become a bit of a silly no-mate. So an outcome of having started a new job, as Andrew said, is less social time. Okay, so there we are. Now we can see that what we've built up is a comprehensive picture. Rather than just showing the plus of the increased income, we've also shown the minus of the lost friends. And you might say that not having friends to go on holiday with is going to detract from my holiday. So there we go, it's actually detracted from my objective of going on holiday. Thank you. Well, I think that's a great little map, and we'll use that, I'm sure, when we come back to other aspects of it. But what we've got here basically is, for our portfolio managers, an understanding of what the objective is and what benefits are going to contribute to that objective and the drawbacks. And for the program team or the project team, they're going to know what work they need to do, business change and producing capabilities, and what the vision is that this ultimately leads to. So that CB, the requirements for creating that or updating that CB must be that they are sufficient to be able to apply for a job that gets me sufficient increased income to go on holiday. Thank you. Right, so here's an example of a benefits map that we use on a regular basis. So here we can see that our objectives were a better experience for our patients and securing the financial future of the trust. This is a genuine benefits map from an HH trust that we worked with a few years ago. So they knew that they had a problem with cancellations of appointments in the outpatient department. People would turn up, for instance, to dermatology and be told, I'm sorry, we can't find your notes, so we're going to have to cancel your appointment because we don't know what's going on with you. We don't know your test results, for instance. So outcome 5 there, no notes lost, no appointments cancelled, is what we need in the future in order to have a better patient experience. Now, what do we need in order for that set of notes to be available rather than them being lost? Well, we need those notes to be updated in an electronic system by the clinicians. So first of all, O1 needs to be our creation of our enabler, isn't it? The electronic records. And here's all the work that needs to be done in order to get those records available in an electronic system. And then we also have a bit of technical work to ensure that they actually have access to it. But it's no use just providing the technology and then assuming that people will use it. So we have to train our clinicians. That's O3. The clinicians are trained to use the electronic patient record. So they produce the notes in the system, and then they're available to read next time. So there we have some business change work down here, which trains the clinicians to access and record information, and also redesigns the process to say that clinicians enter it themselves, as opposed to taking paper notes. Right, so that's an example benefits map. And I hope you can see how various parts of the project and program team and the portfolio and the wider business have a stake in different parts of it. Some of it's work they need to do. Some of it shows, for instance, the stakeholders that they'll need to engage with. And all of it shows what the ultimate aim of it is. Even if you're not in project and program management, once this has gone live and it's become part of the business as usual, the business needs to own this, because the business are the ones actually realizing the benefits, not the program team. Because the program team will be dissolved once this system's gone live, whereas the business is going to continue using this system for years. Okay, now that's great. We've got a view of what we've got to do and why that's a good thing, but we need to think about whether there are any assumptions that we're making and whether there are risks involved in this. So an assumption is an expected outcome. You expect that this will cause that. I expect that doctors' handwriting is why we have so many errors on prescriptions, for example. Or I'm assuming that if I go and work in a part-time job, that I will lose friends because I won't have as much time to socialize. Risks are something which come from outside. They're outside of the control of the program. So under normal circumstances, I am sure that changing our standard operating procedure on where we shop for food will result in us saving money by going to Lidl instead of Marks and Spencer's. The risk is my husband refuses to accept that because he really likes Marks and Spencer's and he doesn't like the stuff that's in Lidl. I don't have control over that. I have influence, but I don't have control. So there's a slight difference here. An assumption is I don't have certain knowledge that my chain of causality, that one thing causes the next, is actually true. Whereas risk is I know that that's true under normal circumstances, but there's the potential for the outside spanner in the works. Now, those of you who do risk management, you might be aware of this particular set of categories. Now, you don't have to use this set of categories. There's all kinds of different sets that you can use for risk management. This happens to be the one I use. But I use it because it helps me to ensure that I've thought about it from all different angles. My natural instinct is to think about the human risks, to think about my husband not being willing to shop at Lidl, instead of thinking perhaps about the technical risks or the regulatory risks, or perhaps that it's not possible what I'm asking in an operational setting. So using something like this, perhaps having a workshop where you take the map and you go through it and assess it from all these different perspectives ensures that you've got a full picture. And then what you've got is the basis of your risk register. So those of you who do risk management, you can understand your risks not just in terms of this may cause a delay of 3 months, but that you're losing 3 months worth of benefit and how big that benefit is. So you get a different slant on the impact of that risk should it come true. So here's our example map with our lost notes, and we've got a couple of assumptions on here. They're these lozenge shapes. So A2, I've got a risk here that the clinicians don't adopt the change. That's the behavioural change stuff. The clinicians refuse to enter notes into the system directly. They want to write on paper and have their medical secretary update it later. And we have a technical one here, which is that the electronic patient record has to work on the hospital's network. And hospitals all have very slightly different networks. Sometimes systems aren't necessarily compatible straight off. That might cause a delay in being able to implement the electronic patient record while they make it compatible. So, moving on from that, success criteria. How do we know that we've succeeded? Well, it's all very well to say we're going to get these benefits, but we need to actually know how big they are. And so we need to measure them. And on a benefits map, we use little flags like this when we're drawing them in Visio. Don't have quite the same technology in Realizer, but I can add them on. So let's go through and have a look at this. Now, I can measure my food budget, can't I? Obviously, I know how much I currently spend, or I hope I do. And I know how much I'm going to spend in the future. Let's find a measure. I'm going to add this measure. And the measure is the food budget, or food expenditure. And it's how much we spend on shopping. Now, I'm going to take ownership of this. I'm going to be responsible for it. So I'm going to put my name against it. It's measured in pounds. At the moment, we're spending £100 a week, and I want to get that down to 80. And yes, it's financial. There we go. So I've put a measure against that. That's the equivalent of putting a flag on it. Now, I can also measure my increased income. I'm going to put a measure on that. Income. Second job. Now it's me that's going out to get this second job, not my husband, so I'm going to put myself against it. Yes, it's measured in pounds. At the moment, I've not got a second job, so I've got no additional income, and I want another 300 a week. Yes, it's financial, and it's increasing my budget. There we go. So I've got another measure. But I wouldn't want to actually just stick with measuring those, because how do I know that what I'm doing is heading towards realising that benefit? Applying for jobs, for instance, is not an instant thing. I might have to apply for several jobs before I actually get the one I want. So as a project team, I wouldn't want to wait until I actually had got a job to know whether I was likely to increase my income. So I'm going to put a measure on here. I'm going to call it job applications. And it's the number of jobs applied for per week. Because if I'm only applying for, say, 1 a week, well, then my benefit's going to be quite late, because it's going to take me a while to find this new job. If I'm applying for 10 a week, hopefully I'll get one quite quickly. I'm going to own that. It's in number of applications is my measure. At the moment, I'm not applying for any, and I want to apply for 10 a week. So there's my goal. There we go. So what I'm saying is, you don't just measure the benefits themselves when they actually happen. On here, you can also track how effective the work is that you're doing in your project plan. So applying for jobs is something that would definitely go in my project plan, and I now have a measure to know how well I'm doing at that particular item. Now we've got, haven't we, a couple of assumptions we said, so let's just quickly jump one of those on this map as well. Here's an assumption, and the assumption is that my hubby is happy to go to Lidl. And if he kicks up a stink, then that outcome of start shopping at Lidl is going to be in doubt, isn't it? There we go. Right, so here on our benefits map of the hospital with its electronic patient note, not only are we going to measure the income that they're going to get from those clinics, because you get paid more for seeing somebody than for turning them away or cancelling the appointment. But I'm also going to measure, for instance, here, the number of times we cancel an appointment due to lost note. And that allows me to have an idea of what the increase in the patient experience is, because I'm not going to measure that directly. I'm going to go by, if we don't cancel your appointment, you're probably happier. So you can see here exactly what we're going to measure to know what we've done to succeed. So that's the benefits map as a whole. What we have on there, as I said, the objectives, which are why people have a shared vision of working on this together, what the benefits are and the disbenefits, so we know how we're going to measure success. We have something that will encourage us. And we have the work that's going to need to be done. And from that, from the change and from the work, we can understand which stakeholders we're going to have to engage with. And stakeholders are important in many senses, but in particular, they can, for instance, tell you about risks that you haven't thought of, or engaging with them could be part of mitigating a risk. So talking to my husband before I actually write a standard operating procedure saying we're going to shop at Lidl means it's less likely that he'll kick up a stink. So the program is effectively shown in its entirety on that diagram. What work am I going to have to do? Who will I engage with? What are the risks that I run? What outcomes am I going to see, which leads to what benefits am I going to realise? How am I going to measure that success? And which objectives am I contributing to? So telling that story and through the program on a page is, I feel, one of the most important things that you get from doing proper benefits realisation. And I'd suggest that a simplified version of that map goes front and centre right at the beginning of every business case. Right. Well, thank you for listening through all of that. I hope by now you've got a better understanding of what benefits are and what it is that you can do to play a part in that. So have we got any questions? Has anybody got any comments? I can see there's a question on the chat from Annetta saying, we had a question yesterday as to how often to update the benefits map. That's a really interesting question, yes. Now, a lot of time can go into building that map in the first place. But if it then gets filed away like the business case and forgotten in a drawer, then that's not really very useful. My feeling is that the map should be updated every time there's a decision which significantly changes the scope, or whenever there is new evidence that a benefit might be different, or if a new one comes to light. So, for instance, if I engage with a particular stakeholder, I had this experience this week. I had been building a benefits map around improving the communication between hospitals and care homes. So you're released from hospital and you're going into care, and if the care home hasn't been given information about you from the hospital, they can't provide you with the best service. And I thought about that from the perspective of the patient and how you might not get your right medication, so you might be in pain, you might not get the right level of support, and therefore you might be, again, in pain, but also unable to do things like wash or dress yourself. But what I hadn't thought about until I talked to a care home manager is the perspective of the care home. And she told me that if they're not told that somebody who's been released from hospital has, for instance, norovirus or MRSA, then they don't know to treat that person in isolation so that they can't infect the rest of the care home. And that's how norovirus tends to spread in care homes, is people coming from hospital with it, but the care home hasn't been told. Now, obviously, that's a huge risk to the patients, and it increases the cost of the care homes. But what she also told me is when that happens, they have to steal off the care home, which means that friends and family can't visit, so that they can't spread infection. And that can cause real distress for people who maybe have just come out of hospital and they've been isolated from their social network, and now that social network is still prevented from being able to come into the care home and be with them. So how often do I update the benefits map? Really whenever I've got new information. And quite often when we realise that we have a problem somewhere, we'll dig out that part of the map and say, did we get something wrong here, or have we missed something? And it really helps us get to a root cause of issues that come up. Has anyone else got other experiences that they'd like to share about using their benefits map?
Well, there's one that I've got, Claire, and it's something that I always remember, and it's something that me and you did, and it's my go-to example of something you said before about the difference between the technology and the human change, and that's where we examined a particular change program, and much to the surprise of, well, I think it was much to the surprise of a lot of people who were in the room, to discover that the implementation of an IT system was a tiny fraction of what was needed in order to implement their vision. And by setting out everything that we did using the benefits map, it really showed them the scale of the task at hand and alerted them to a lot of things which I think would have become apparent later on down the line, but weren't apparent at the time. So it helped them to make much wiser investment decisions as a result of seeing the whole picture of what it is they were talking about when they were talking about implementing their vision.
I do remember that, and that's a fantastic example. And yes, it goes back to that quote from Virginia Mason, doesn't it? They thought that what they had was a technology project. And when they actually looked at it and mapped it out properly with a benefits map technique, they realized it was 80-20. 20% of it was technology. 80% of it was changing how the organizations work together, what their processes were, their cultures, whether they trusted each other. And the technology really just underpinned that and made the communication possible. But it wasn't a technology project, was it, Richard? It was a change project.
Absolutely.
Fantastic. Thank you for sharing that. Has anyone else got others that they'd like to share?
Hi, Claire. It's Gareth.
Hello, Gareth.
Yeah, I suppose similar to probably what following on from Richard said, I suppose there was a case of so many benefits were being identified, but actually which ones they were going to focus on. And they found the map really useful to link in with that and then link in with the amount of work that was involved for those benefits.
Absolutely.
So that's where I've seen particular value.
That's a great idea. Thank you, Gareth. Yeah, so using the map to say, okay, we could get a huge range of benefits, and it involves a lot of work. But if we narrow it down to the essentials, in Agile you might call it the minimum viable product, then you can see what it is that's going to have the big bang for the buck. And the portfolio level, you can think about that from the perspective of which of the organisation objectives is the current main priority, and therefore focus on the work that leads to benefits in that area.
I was just going to say, yeah, the organisation, then they said they were going to go back and ask from that perspective, you know, what does the organisation want to focus on? Because they've only got a finite resource, so what bits were they going to focus on with that bigger picture in mind?
Brilliant. Oh, fantastic. A great success story. Well, thank you, everybody, for all your contributions today. I've had a great time. I hope you have too. I hope you've learned something new. And do please pass on the link once we post it. And you can get in touch with me, claire.dellar@nhs.net. I'll put my phone number on there as well, or you can link in with me. Thank you very much, everyone.